Barbara is a 60-year-old patient visiting a new primary care provider to discuss her antidepressant medication. Barbara completed the audit screening tool as part of the visit.
Thanks for filling it out. We give this form to everyone once a year, regardless of why they come in. It helps us provide better care. Is it okay if I take a look at what you put down?
Sure.
So let's see. It looks that you drink alcohol at least 4 times a week on average, and you usually have 3 to 4 drinks when you do drink.
Usually 3 drinks and glasses of wine.
Okay. That's at least 12 drinks a week.
Something like that.
Okay. Just so you know, my role when we talk about alcohol use is just to share information about risk and to help patients who want help. This is different than telling them what I think they should do. I don't do that.
Okay.
What else can you tell me about your drinking?
Well, I usually drink when I'm at home trying to unwind, and I drink while I'm watching a movie, and sometimes I take a bath, but I also drink when I take a bath sometimes.
Okay. So can I share with you some information on alcohol use?
Okay.
Okay. So there has been a lot of research on alcohol use, and the guidelines we use in this country says that having 7 or more drinks per week can raise the risk of health problems for women.
7?
7.
Wow, I knew my doctor didn't like me drinking the amount that I did, but I didn't know that 7 was the limit.
Yeah, you're surprised to hear that?
Yes. What kind of health problems?
Well, things like heart disease, cancer, liver problems, stomach pains, insomnia. Unfortunately, people who drink at a risky level are more likely to be diagnosed with depression, and alcohol can make depression worse or harder to treat.
Well, that's not good news.
Well, how do you think your drinking relates to the depression you've experienced?
Well, to be honest, I drink sometimes when I'm feeling down, and I find it more interesting and not so blah.
Okay. And how do you feel after you drink?
Well, then I feel blah again.
So there are some answers on this form here. Less than monthly, you drink more than you intended to.
Yes, on occasion.
And sometimes you feel guilty after you drink.
Sometimes I just don't like how much I drink. I sometimes finish a bottle in one night.
So you're not proud of finishing a bottle?
No, it's not like I get crazy or anything, but I just don't like the amount that I'm drinking.
Right. By the way, binge drinking is defined for women as having more than 3 drinks, and there are about 5 drinks in a bottle. So you enjoy drinking wine because it helps make things a little bit more interesting when you're feeling down. But at the same time, you don't like drinking when you have more than you want it to, and then the depression returns after you drink.
Yes, sometimes I feel worse after drinking.
Where do you want to go from here? What do you want to change about your drinking habits?
Well, I don't think that I'm ready to cut down to 7 drinks a week. That seems like a lot. But I would consider cutting back to 2 drinks a night. I think that will be my goal.
If I gave you a scale from 0 to 10, 0 being not ready at all to cut back on drinking, and 10 being very ready, what number would you be at?
I'd say an 8.
Okay. Why do you think it's not something less, like a 6?
Well, I'm more ready than a 6 because I'm ready to cut back on my drinking and I don't want to make my depression any worse.
What would help you cut back to 2 drinks?
Maybe having less wine in the house?
Having less wine in the house will help.
Yes.
What else besides drinking helps you relax and unwind in the evenings?
Well, I like to watch movies, read a book, and take a bath, but sometimes I drink when I take a bath.
So it's not just wine that helps you relax. There's reading a book, watching a movie, and taking a hot bath too.
Yes.
Okay. So it sounds like you have some reasons to cut back on drinking, and you have ways to relax besides drinking. And it sounds like you're pretty ready to cut back.
Yes.
Great. I'd be interested to see how well you do on your goal in the next few weeks. Would you be willing to come back and talk to me about it?
Sure.
Great. So let's see how well you're doing with these new meds.
Okay.